Do you know that tailbone pain is 5 times more common in women than men? Still to the end to find out how do doctors diagnose and treat tailbone pain. Welcome to another episode of Doctor Says. First up, what is a tailbone? It is the bone at the most bottom part of your spine, scientifically known as the coccyx. Hence the term coccydynia, which directly translates to pain in the coccyx. You must be wondering, why does coccydynia happen 5 times more common in women than men? It is no secret that this could be due to injuries that may occur during childbirth, as the coccyx is located more superficially in women and therefore is more susceptible to external trauma. Another common risk factor for tailbone pain is obesity. It is hypothesized that obesity may actually lead to changes in the ways people sit or by increasing the total weight-bearing load to the coccyx. The main causes for tailbone pain are, first, external direct trauma. For example, the most common would be a fall in a sitting position. Second, repetitive minor trauma, which may occur from prolonged sitting. Common examples would be a bus or taxi driver, a pilot, a motorbike racer, or even a bicycle rider. Third, maternal injury during childbirth, as mentioned before, and this is especially true if the delivery is difficult and require the use of forceps. Fourth, coccygeal instability. Some people have a higher mobility between the joints connecting the coccyx and the sacrum, also known as sacrococcygeal joint, and this is one of the causes for tailbone pain. And lastly, osteoarthritis or bone spur may occur at the coccyx, causing pain as well. In patients with coccydynia, they will often complain of pain in the tailbone on sitting, especially when leaning back. Some may experience abrupt pain from sitting to standing. Some may also feel pain with defecation or during sexual intercourse. It is easily diagnosed by doctors as the pain and tenderness are well localized to the coccyx, and the pain can be reproduced with direct pressure on the bone during a physical examination. No x-rays or special investigation is usually required initially. Now the part you have been waiting for, the treatment of coccydynia. The good news is that 90% of it will resolve without any medical intervention. So, relax. Most patients should be managed conservatively for at least 2 months before a more aggressive therapy is tried. One can try heat or ice local therapy, as well as analgesics like NSAIDs for pain relief. We advise our patients to protect their coccyx during sitting by leaning forward to redistribute the pressure away from their coccyx. And a special cushion known as a wedge-shaped cushion actually does this job pretty well. Link available in the description below. If symptoms persist beyond 2 months with treatments above, one will require further investigations such as an MRI of the coccyx to evaluate for fracture and dislocation. For severe symptoms, local injection with an anesthetic or steroids to the coccyx will be the most effective treatment. A word of caution, any kind of manipulation or massages to the area may be helpful if there is muscle spasms in the proximity. However, if there is a fracture or dislocation of the joint, massage may actually worsen the symptoms.
Oh no!
And finally, if all things fail, surgical resection of the coccyx is performed as the last resort. But of course, there would always be the risk of surgery. So there you have it, guys. Thank you for watching, and I'll appreciate if you can give me a little thumbs up for the YouTube algorithm. Stay safe, stay healthy, and see you next week.